My initial assessment of Lucy's situation includes her strengths, my concerns, the cause for my concerns, and any additional information that I might need. So Lucy's strengths include her resilience, situational awareness, and her mentation. My concerns for Lucy include frequent falls, her vital signs, safety, and loneliness. I'm concerned about Lucy's frequent falls because it's causing frequent trips to the emergency room. According to her chart, there are no major injuries as of yet, but the potential for each fall to worsen is high. Due to her age, history of osteoarthritis, and a right knee replacement 9 years ago, I worry that the falls may become less minor. My concern regarding Lucy's loneliness is not without reason. Some people can live alone without problems for a really long time. However, in Lucy's monologue, she mentioned that she never had dizzy spells like she does when Julia was alive. Sometimes an adjustment disorder can present with both mental and physical symptoms. She also mentioned that she felt safer before Julia passed and that she rarely gets any visitors. This is concerning for her mental and physical health. Regarding her vital signs, I would just closely monitor her oxygen saturations and possibly request a breathing treatment from the provider. Additional information that I might need could include her daily routine and what that looks like, her independence level, her emotional status, and what her goals are for herself. The priority concern for Lucy is her safety. Although I am also concerned about her loneliness, her physical safety and wellness is more urgent. Taking actions to prevent the risk of worsening falls is necessary. This might be difficult though, considering Lucy lives at home alone. Something I believe to be a large concern as well is Lucy's mental health. In the 3 months since Julia passed, she's fallen at least 3 times that we know of. She doesn't get regular interaction and connection with other human beings, and she verbally confirms that she did not feel this way with Julia around. If we were able to assess her mental state and offer healthy coping mechanisms or solutions for her grief, she might begin to feel better physically. There was an article published by the Gerontological Society of America that says more than 50% of recently widowed persons experience physical symptoms as well. These typically decline as time passes, but that doesn't lessen her current issue given the frequent falls and risk for trauma. For solutions, some interventions that I would put in place to minimize the risk of harm for Lucy prior to discharge would be ensuring ambulation is assisted by encouraging her to utilize the call bell if she desires to get up. I would recommend that a walker be ordered for her to take home if she doesn't have one upon discharge to educate the importance of use and how to properly ambulate with an assistive device. I would assess Lucy's mental state aside from her orientation to determine her readiness to learn. Optimizing Lucy's care, I would sit down and review her physical symptoms, her subjective symptoms and feelings, and her goals. For referrals, I would recommend referrals to home health care, an assisted living facility, behavioral health, and even a social worker. I believe that if Lucy was in a safer environment with more people to connect with more supportive equipment for her decreasing mobility, with people available to assist her when needed, that she would be in a better place mentally and physically. One big thing to understand with this potential solution is that a lot of people don't want to leave their homes and move somewhere like an assisted living facility. So another option in this case could be frequent home health care visits. This gives Lucy the opportunity to see someone regularly who can help with things that she's experiencing difficulty with. I recommend the behavioral health referral so that Lucy can have resources to discuss her grief and find healthy coping mechanisms. Lastly, I recommend a social worker to determine the best route for Lucy moving forward, considering her means to obtain any of the information or outcomes that I previously mentioned. The response that I would share with Lucy describing my concerns and options for her care is as follows. Hi Lucy, it's Charlie again. I wanted to discuss with you things that I am concerned about and what I think we might be able to do about it. I'm concerned that your frequency of falling is increasing and putting you at a higher risk for trauma or a serious injury. Your safety is a top priority for us, and I want to ensure that we go over several different ways to keep you safe. It appears that you're still grieving Julia's loss. I want to discuss your readiness to open up to behavioral health and potentially get some healthy coping mechanisms into place. I also think that a social worker can help you determine the best solution for your loneliness while still protecting your independence. Home health care and assisted living facilities are great options if you would consider them. How do you feel about these options? Do you have any questions about this potential plan for you? To take action, again, Lucy's safety is my highest priority. Solutions that I would implement to address Lucy's safety include the following: using a high-risk armband or a high falls risk armband and a room sign outside of her room to identify her as a falls risk for anyone that encounters her, ensuring education and proper demonstration on the use of the call bell. I would keep her room free of clutter, screen her current mobility skills, evaluate her risk of falling based on current medications. I would orient her to her room, maintain the bed in a low and locked position with side rails up, ensure adequate lighting, increase observation. I would probably implement ×2 assist with ambulation, ensure her room is near the nurse's station, and consider a physical therapy assessment. The SBAR to the oncoming shift nurse is as follows. So situation: this patient is a 74-year-old female who was brought to the emergency department after falling at home due to a dizzy spell. Her background: Lucy has a recent history of increasing falls over the last 3 months. Her partner Julia passed away 3 months ago from terminal cancer, so she lives alone. She has presented to the emergency department for falls in her home several times since losing her partner, and she does have a history of osteoarthritis and a right knee replacement at age 65, affecting her mobility. For her assessment, she's currently alert and oriented ×4 with no apparent injuries aside from a scrape to her left arm that has been dressed with gauze and tape. Her most recent set of vitals are blood pressure 160/88. Her heart rate is tachycardic at 102 beats per minute. Her respirations are 20. Her oxygen saturations are in the 90s with 6 liters of O2 via nasal cannula, and she denies any pain at the moment. She has a saline lock in her right arm, and the previous neurological workup from her last visit here was negative. I recommend implementing falls risk precautions, ensuring adequate oxygenation saturations by switching to a simple face mask to maintain her SATs over 92, following up with the provider for the social work, physical therapy, home health referrals, assessing where she is in the grieving process, and ensuring adequate verbal and printed education prior to discharge.